Discúlpame, pero voy a hablar en inglés, probablemente Spanglish, porque yo creo que su inglés es mejor como mi español y castellano. So I will try to speak slowly, and if people do not understand, wave your hand. My understanding is that many of the students have their final examinations right now, yes? So you're all the students that did very well. You don't have to worry about your final examination, correct? Que bueno. What I'm going to speak about in the opening for 10 minutes is the what. What should we be doing in medical schools with regard to family medicine? And the reason for this is that we know that as we look around the world, the health systems that do better, that have better health outcomes, greater equity, and lower costs, are built on family doctors. As a result of that, what we need to do is train enough family doctors so that our health systems have those benefits. But to train enough family doctors, we have to have medical schools that produce enough students interested in becoming family doctors. And so these are the what. These are the what we need to be doing in every medical school. The first is to reach down to young children, to the colegio primario, and get children interested in science. Then we need to admit to medical school students that are interested in careers as family doctors in primary care. And when the students arrive in medical school, we need to give them support. So for example, in the United States, all of our medical schools have a family medicine interest group. And they put on projects in their communities, they spend time with family doctors. We bring them together every July in Kansas City, where our society is located. We bring together 3,000 of them every year. And they have a chance to meet with each other, to do educational sessions, to debate policy. We know during the curriculum of medical school, it's also important that students have early experiences in family medicine. And this can be in a number of ways. So for instance, at some medical schools, you'll be matched or paired with a family doctor for all the years of medical school, and that person serves as a mentor. Another experience that we see is that you'll get a family where the woman is pregnant and you follow the family through the pregnancy and in the care of the baby. All of this done with the family doctor. In many, many medical schools around the world, it's the family doctors who teach the students how to take a history, how to do a physical examination. Is that true in your school? Is it the family doctors that do a lot of the, what we would call physical diagnosis class, or teaching you how to take a history? Yes, no? Or maybe you didn't understand my question. All right. Next, it's very important to have a required experience, a clerkship or a rotation in family medicine, and all along the way to try to help support students that do have an interest in family medicine. It's also important for the family doctors to be seen as being good doctors, good clinicians, able to take good care of patients at the medical school, because the other doctors who are seen as important clinicians, people that take good care of patients, the surgeons and hematologists and all the other specialists, that's an important thing, because then people recognize that you have credibility. We also need better research in family medicine. That helps to make what we do more interesting and more useful. I'm going to speak more about that in the clausura, the closing. And then lastly, we need to develop leaders. So you actually need to work at having young people become leaders. You can teach them leadership skills, because advocacy is very important. Not only with your government, but with other physician organizations, with the media, with the public at large. And those skills can be taught. And I was going to use briefly the United States as an example of some of the changes that we've gone through in family medicine. So in 1965, the first department in a medical school was created at the University of Miami. This was before the specialty was even created. That did not happen until 1969. In 1966, also in Miami, the first residency training program was established at Jackson Memorial Hospital, which is part of the University of Miami. Today in the United States, 2011, we have 450 residencies, one in every state. There's no other specialty that has a residency in every state in the United States. And we have about 8,500 residents in training. They train for 3 years in our system. We have today about 163 medical schools, and we include schools of osteopathy. I know that's a little different in Europe, but they're really the same as in the United States. And we only have about 10 schools that we call orphan or target schools that do not have a department of family medicine. Interestingly, they tend to be the schools that get the most research dollars from NIH, Harvard, Yale, Hopkins. And in 95% of the medical schools, all the medical students will have a required experience in family medicine, a clerkship, usually during one of their later 2 years of medical school. And in North America, as you may know, you go to university for 4 years, and maybe in chemistry or biology, and then you go to medical school for 4 years. The first 2 are science only, pathology, histology, physiology. The last 2 are clinical, and then you go do your residency. This idea is also beginning to take hold in Europe, and just last month was published an article that described a core curriculum that they would like to see across all of Europe so that all medical students in Europe have an undergraduate experience in family medicine. So the last thing that I'll say about this to begin our session today is that I believe that every medical school, if it's going to be seen as a high-quality school, should have a department of family medicine. And that department should be supported in all of its missions. It should have enough funds, enough money to do its job. It should be involved in teaching throughout the entire curriculum. It should be regarded or seen as having clinically skilled doctors. It needs to be involved in the community because we need to do a better job in medical schools of helping the people that live right around us. It needs to be admired for its scholarship, for its research, and it needs to be respected as a leader in medical school. So I hope you're able to understand some of what I've said, because the next talk is going to be even longer at the end of the session. So, muchas gracias.